Hi, today we're going to talk about the benefits of infant massage for infants and parents in the NICU and how you could use this information in your clinical practice by helping more people. Hi, I'm Dan, and if you don't know me, I do research on research, meaning I bring you information on the latest research about massage and how you can be a better massage therapist in the coming years. Today, we're talking about the benefits of infant massage for infants and parents in the NICU. If you don't know what the NICU is, the NICU is the Neonatal Intensive Care Unit in hospitals for premature babies or babies who are just sick. And of course, infant massage is really important and is the basis of all sensory information and touch for a growing brain and a growing baby. As always, we have to look at various questions of a study. So this, if you could see the picture of this study, if you're listening on the podcast, you won't see this, but this is a really nice picture of a baby who looks quite healthy in the NICU with its mother or carer comforting the baby while there's a lot of leads and cords and looks like a feeding tube up through the nose. Which is not uncommon for a child to be like that in the NICU. So how we located this study, we looked on PubMed and did a search from 2019 onwards and then put in massage and then basically came up with this study. So we're choosing research from 2019 onwards just because there's so much research obviously out there. We have to pick a date to start from. 2019 means it's fairly up-to-date research, which is great. Now, this particular study is from a women's health journal in the US. The study is conducted by two ladies by the name of Britt Frisk-Pados and Kelly McLaughlin Bell in 2019, and it's actually a literature review. So the researchers are interested in massage, neonatal massage in particular, or young infants, and they have done a lot of reading and have presented what they have found in a literature review. And often literature reviews move on to some randomized controlled trials or some other study, which is great. So we want to find out what research question they asked through the literature review. So basically, they're not asking a specific question, they're just outlining the benefits of infant massage for infants and importantly parents in the NICU. All right, if we have to look at how they define massage as well. Let's look at the clinical implications of infant massage first. And they state that there is evidence that infant massage has beneficial effects for infants and their parents, including strong evidence that it reduces pain during painful procedures such as heel stick and tape removal. This study is a bit close to my heart as well because I've looked after about 5 babies in the NICU as a foster carer. And if you've ever seen a little baby get a heel stick needle or some tape removed, they scream like mad. So that'd be good to reduce their pain. Infant massage has been associated with decreased stress, anxiety, and depression among parents who provided massage to their hospitalized infants. And then they go on to talk about how nurses can teach parents how to do massage. Let's look at their definition of massage, how they actually define massage. So they look at infant massage and the history and techniques of massage, and they state that massage is an ancient therapeutic technique that was first documented in the Chinese medical literature more than 4,000 years ago. Today, mothers around the world massage their infants and consider it an essential part of parenting to enhance infant health and facilitate bonding. This is what I really like, and this is how they define massage. Massage therapy is the systematic application of tactile stimulation, which can be applied by using a variety of techniques and results in stimulation of the sensory receptors in the skin, muscles, bones, and joints. They also go on to say massage may include touching, stroking, friction, stretching, compression, and passive movement of joints. If you can think about a baby that's premature, that weighs 1.5 kilo, you can't manipulate joints. All you're providing is stimulation to the skin for changes of the brain to take place. And that's how I believe massage works, rather than moving bones and joints around. Massage is purely sensory, and this is a typical example of how sensory massage would work. Let's look at the effects of massage on premature babies. Look at infant weight gain. So weight gain has been most commonly reported infant outcome of research on infant massage. Bader and colleagues reported a meta-analysis of 13 studies in which researchers reported on infant daily weight gain and found that infants who received massage gained 0.53 grams more per day than infants who did not receive massage. Let's say weight gain, length of stay. So the second most commonly reported outcome of research on infant massage is length of stay. Bader and colleagues, 2015, conducted a meta-analysis of 6 studies in which a length of stay was reported and found that infants who received massage did not have a significant reduction in length of stay. However, in more recent studies, a significant decreases in lengths of stay have been found. So a good indication there of different studies reporting different effects of massage, which is what we really want. We want a number of different studies to report different effects and seeing the outcome of massage in infants. Feeding. Researchers have evaluated the effects of infant massage and a variety of outcomes related to feeding. Bader's 2015 meta-analysis of data from 5 studies concluded that although caloric intake was greater in infants who received massage, the difference was not significantly different. So it looks like infants who had massage there actually ate more, but it wasn't significantly different at the end of the study. Neurodevelopment, similar to other outcomes, neurodevelopment has been measured in a variety of ways. Meta-analysis of the 3 studies using a Bayley scales of infant development found that mental development was significantly greater in infants who received massage, but that motor development was not significantly different. Let's look at pain. Pain. There was a strong evidence that infant massage reduces pain during painful procedures. In the only study reported so far on infant massage in infants with neonatal abstinence syndrome, Han and colleagues, 2016, found that use of massage alleviated infant symptoms of withdrawal while promoting mother-infant bonding. So what actually happens when you actually massage an infant? And the researchers go on to look at the mechanisms of action. The mechanisms of action of infant massage are not well understood. In the infant, the mechanism of action is believed to be related to the stimulation of the vagal nerve through the activation of pressure receptors and ultimately an effect on the neuroendocrine stress response system. So that's really good that they've understood that or documented that we don't actually know what massage does, especially in a neonatal baby. The first potential mechanism was activation of the vagal nerve, resulting in increase in gastric mobility and a release of food absorption hormones. The second possible mechanism was release of insulin-like growth factor, IGF-1, leading to greater weight gain by promoting muscle and bone development. We go on to talk about parents. For parents, infant massage is thought to help them take an active role in their infant's care, which can help the parents feel more attached and confident and reduce their levels of stress and anxiety. They look at the implications or the current limitations of the current literature, and they talk about the actual massage techniques they use, which is very important. One of the questions I like to be looked at, and they talk about the most well-studied massage technique was developed by Field in 1986. Involves a 15-minute moderate pressure massage, but a variety of alternatives have been used as well. So there's not one real massage technique that actually helps neonatal babies. Based on the current available literature, we still don't know which massage techniques are best, which infants benefit most from massage, whether oil should be used or not, and what timing, duration, and frequency of the massage results in the best outcomes. They go on to say much more research is needed to determine these particular aspects of infant massage in the NICU. They go on again to state that another limitation of currently available research on infant massage in the NICU is that almost exclusively limited to infants born preterm by their mothers. Research on the effects of infant massage on other critically ill infants is much needed, and future research on the effects of massage for parents should be actively engage fathers as well. Nice to get the fathers a bit of a mention in there. We'll talk about the implications for practice in 1 minute. So the conclusion of this is they conclude that studies on infant massage in the NICU have provided evidence of positive effects for both infants and their parents. Although the research has been limited in some ways, almost no studies have reported adverse effects of massage. Good to know that massage doesn't hurt. The adverse effects that have been reported have been minor, such as mild rash, which can happen in adults as well, as you probably know, suggesting that is a safe practice with positive benefits. Additional research is needed to determine the ideal technique. Will we ever get there? Probably not. Timing, frequency, no, we'll never get there probably. And duration of massage to optimize benefits for infants and parents. Very hard to measure, as we know through massage. Different massage techniques works for different people, and I presume that infants would be the same. Neonatal nurses are in a unique position to teach parents to perform massage with their hospitalised infants. So they go on to talk about how the nurse's role in massaging neonatal babies. Let's look to see if we have answered our questions. Firmless. How we located the study? Yes, through PubMed. Where is the study from? It's from the US, in a US journal. What type of research is it? It's a literature review. The research question they ask, well, they don't really ask a research question. They just discussing the benefits of massage for neonatal infants. They have a really good definition of massage. The massage techniques they use is questionable because there's no one real massage technique that they found that uses. The result is very positive in terms of massage is a good sensory stimulation for babies. Does massage work? Yes, although no real secure clinical evidence, but we know that it's important for touch. How can you use this in your clinic? Well, if you have clients who are obviously pregnant and having a baby, it's important to bring up with them the idea of massaging their baby, especially if their babies are in the NICU, because you tend to not touch babies as much in the NICU. So if you get hands-on with babies in the NICU as much as possible, then that would benefit their growth over time. And also just massage with babies and touch throughout their early weeks, months, even the first few years, and going on with the importance of touch, cuddles, and all that sort of thing. So this is how you can talk to your clients in the clinic who are pregnant, both fathers and also or both mothers, and also talking about to fathers about the importance of hands-on therapy for babies. Many thanks. This has been a great article. If you want the details of the article, I'll attach them to this podcast or to YouTube. Many thanks, and we will talk soon. Bye.